Menopause and cardiovascular disease, what women need to know. Menopause is a natural biological process that marks the end of a woman's reproductive cycle. It usually occurs between the ages of 45 and 55 years, but it can happen earlier or later in some women. Menopause is associated with a range of physical and emotional symptoms, including hot flashes, vaginal dryness, mood swings, and insomnia. However, what many women may not know is that menopause also increases their risk of developing cardiovascular disease, CVD, the leading cause of death for women in the United States. In this article, we will explore the relationship between menopause and CVD and what women need to know about their risk factors, symptoms, and prevention strategies. Part 1. Understanding cardiovascular disease. Cardiovascular disease refers to a group of conditions that affect the heart and blood vessels, including coronary artery disease, heart failure, and stroke. According to the Centers for Disease Control and Prevention, CDC, CVD is responsible for approximately 655,000 deaths in the United States each year, or about 1 in every 4 deaths. CVD can develop slowly over time, and many people may not experience any symptoms until a heart attack or stroke occurs. The risk factors for CVD include 1. Age. 2. High blood pressure. 3. High cholesterol. 4. Smoking. 5. Obesity. 6. Physical inactivity. 7. Diabetes. 8. Family history of CVD. Part 2. Menopause and cardiovascular disease. Menopause can affect the risk of CVD in several ways. For example, 1. Decreased estrogen levels. Estrogen is a hormone that helps protect the heart and blood vessels. 1. During menopause, estrogen levels decrease, which can lead to changes in the structure and function of the blood vessels and an increased risk of CVD. 2. Changes in lipid profile. Menopause can lead to an increase in low-density lipoprotein, LDL, cholesterol, also known as bad cholesterol, and a decrease in high-density lipoprotein, HDL, cholesterol, also known as good cholesterol. 2. This shift in the lipid profile can increase the risk of atherosclerosis, or the buildup of plaque in the arteries. 3. Increased inflammation. Menopause can lead to an increase in inflammation in the body, which can contribute to the development of CVD. 4. Other risk factors. Menopause is also associated with an increased risk of other CVD risk factors, such as high blood pressure, diabetes, and obesity. Part 3. Symptoms of cardiovascular disease in women. It is important for women to be aware of the symptoms of CVD, as they may be different from those experienced by men. Some of the common symptoms of CVD in women include 1. Chest pain or discomfort. 2. Shortness of breath. 3. Nausea or vomiting. 4. Pain in the back, neck, jaw, or stomach. 5. Dizziness or lightheadedness. 6. Fatigue. Women may also experience atypical symptoms, such as 1. Pain or discomfort in the arms, neck, or jaw. 2. Heartburn or indigestion. 3. Sweating. 4. Insomnia. 5. Anxiety. Part 4. Prevention strategies for cardiovascular disease. Fortunately, there are several steps that women can take to reduce their risk of developing CVD. These include 1. Lifestyle changes. Women can reduce their risk of CVD by making lifestyle changes, such as 1. Eating a healthy diet that is low in saturated and trans fats, cholesterol, and sodium, and high in fruits, vegetables, whole grains, and lean protein. 2. Engaging in regular physical activity, such as walking, jogging, swimming, or cycling, for at least 150 minutes per week. 3. Maintaining a healthy weight and body mass index, BMI. 4. Quitting smoking and avoiding secondhand smoke. 1. Limiting alcohol consumption to no more than 1 drink per day. 1. Medications. Women may also benefit from medications to manage their CVD risk factors, such as 1. Statins. These medications can help lower LDL cholesterol levels and reduce the risk of heart attack and stroke. 2. Blood pressure medications. These medications can help lower blood pressure and reduce the risk of heart attack and stroke. 3. Aspirin. Low-dose aspirin may be recommended for women who are at high risk of heart attack or stroke, but it should be taken under the guidance of a healthcare provider. Hormone therapy. Hormone therapy, or the use of estrogen and or progestin to manage menopausal symptoms, may also reduce the risk of CVD in some women. However, hormone therapy is not appropriate for all women, and the decision to use it should be made in consultation with a healthcare provider. Regular health screenings. Women should have regular health screenings to monitor their CVD risk factors, such as blood pressure, cholesterol levels, and blood glucose levels. They should also discuss their menopausal symptoms and CVD risk with their healthcare provider. Menopause is a natural part of a woman's life, but it can also increase the risk of cardiovascular disease. Women need to be aware of their risk factors, symptoms, and prevention strategies to protect their heart health. By making lifestyle changes, taking medications as prescribed, and seeking regular health screenings, women can reduce their risk of CVD and live healthy, fulfilling lives.